having a deeper dive into raising expectations and the way in which they've actively centred the voices of care leavers in shaping the approach and consolidating the impact. The Raising Expectation Initiative collaborates with TAFE and university partners to support care experienced young people in accessing and thriving in vocational and higher education. By providing resources to overcome social and financial barriers, the team aims to increase care leavers' participation in further education, opening doors to improved employment prospects and life opportunities so fundamental. Pearl Goodwin Burns is the Senior Manager of Education and Program Manager for Raising Expectations. Pearl has worked alongside care experienced people and lived experience experts as a social worker, research assistant, and direct student support roles to support more equitable access and success in education. We will have a small amount of time at the end for questions, but I'm going to hand over quickly now.
Thanks, Mandy, and hi everyone. Thanks so much for having us today. Super keen to talk about raising expectations and hear from Ruby and Zach a little bit later, but I'm going to start off with giving us a bit of an overview of what raising expectations is. If I could just figure out how to share my screen, that would be great. Okay, we're here. So I just need to reconfigure that. All right, so this theme of celebrating every journey deeply aligns with our work, which is to increase the participation, access and success of care experienced students studying at TAFE University across Victoria and beyond. So very keen to talk to this today, and I will move through. I would like to acknowledge that I'm also on Aboriginal land. I'm joining from Wadawurrung country, and I'd also like to acknowledge that our TAFE University partners also operate on Aboriginal land, which is unceded, and this always was and always will be Aboriginal land. So just taking a moment here to share this slide. Ruby, you're on here too. So this slide features just some of the remarkable care experience students that we've had the privilege of getting to know and support and celebrate on their journeys through TAFE University. We've featured stories of these care experience students on our website, which we'll share a link to in the chat shortly. And we're really lucky to be joined by one of them today, who will speak in a little bit. Just before I tell you what Raising Expectations is, I guess it's good to give you some context about why we are called Raising Expectations. So I've included a quote here from a young woman that we interviewed as part of some research that we completed with our partner universities when we were setting the program up. And I'll let you read that, but we know children and young people often have low expectations placed onto them by others around them, which in turn does sometimes become internalized low expectations for those children and young people. And as I've pointed out on this slide on the left, this is more of a reflection of a complete misunderstanding from other people than it is of the actual capacity and the great potential of care experienced young people. So we saw that quite pervasive deficit-focused narrative that I just spoke about, and we knew we wanted to change it. So the centre partnered with a group of leading academics, some with their own lived experience of the out-of-home care system, to establish what we call the Raising Expectations model. Since then, we've expanded to 7 institutions, and we work with all 13 TAFEs across Victoria. I'll touch on that shortly. But this is the model on a page, basically. We are entering our 10th year, so in many ways, it's pretty amazing to be here today talking about this in our 10th year. The program has been really a cultural change piece in some ways. So we set out to raise expectations for and about young people and adults with a care experience about their potential to succeed in tertiary education. But it also has a heavy focus on practical on-the-ground support. We do this through cross-sectoral collaboration between the centre, our child and family services sector, the post-secondary education sector, and support from our partners at the Victorian Government. We are the first program of its kind in Australia, and although there is plenty of work to still be done, we have so much to celebrate. So we can see here our lovely TAFE University partners on there. So we work with 7 TAFE universities who provide tailored support to care experienced students on the ground. And this support includes academic and financial support, even initiatives like dedicated student housing spots on campus. And this is really to ensure that those students have a housing option, but also kind of embedding support on the ground. It's to ensure that care experience students have someone that they can turn to right from prospective stage to completion stage. The centre also deliver training and professional development to our partners. So there is that on the ground awareness of the sorts of challenges and experiences that care experience students may have faced along their educational journey, making it much easier for care experience students to feel seen and seek support. Our very valued partners also collect data about the participation of care experience students, and that is the only data set of its kind nationally. So it's a really another important part of our program. We also deliver 2 fabulous peer mentoring programs. So the Centres Raising Expectations team run these programs, and they're aimed at supporting care experienced young people to re-engage or to remain engaged in their education, including TAFE and university. I guess the key part here for this session, I don't have a lot of time to go into detail, is that it's really unique because we are offering care experienced young people a care experienced mentor. And that really builds that sense of belonging and community that a lot of young people don't have when they're starting out at TAFE and university. Now, Deb mentioned 1,200 students at the beginning of this session. Again, I don't have heaps of time to go into this, but it's really worthwhile pointing out. We started with just 43 students 10 years ago now, in 2015. And this year we have 1,273 students actually participating at our partner universities and TAFEs. So we're really, really proud of that number. There's lots of journeys worth celebrating here. And I'm keen to get on to the next part so we can hear from one of our fabulous students. What I do want to call out here in this lovely slide with lots of cool information is the 603 in the top right corner. So that's 603 study completions that we have seen just in the last 4 years alone. So this data represents the journeys of 603 care experienced students who have defied those low expectations that have been placed onto them, and they've successfully completed their courses, many going on to study more courses afterwards to go into masters, etc., or to employment, and many working in fields with skill shortages. All right. We've heard a lot about principles for lived experience participation in research, and really I'm going to echo a lot of what has already been said here because it's actually reassuring to hear, to be honest, because a lot of these principles have already been spoken about. But lived experience has informed our program in so many different ways, right from the development of the program, throughout our partner university's research, and in how we've designed our models of support both at the TAFE and university level. When I say lived experience participation, I'm really referring to when we listen to, work in partnership with, and platform care experienced young people and adults in our work. I won't have time to cover the range of ways we've done that in the last 10 years, but I will briefly go through what our principles are for engaging with lived experience experts. Number one, and this has been driven home today, people with lived experience are the experts. So centering lived experience in every way that we can, because we acknowledge those with first-hand experience are the experts. Number two, inclusion right from the very beginning. So we aren't seeking to confirm what we already think. We want to be informed and even challenged by lived experience perspectives. Number three, being mindful of power dynamics. So sharing power whenever we can and doing this in a way that centers people with lived experience as the holders of knowledge and solutions. Number four, we steer clear of tokenistic approaches, offering genuine opportunities for co-design, co-facilitation, and ongoing feedback loops. So it's not just a tick the box activity. Remuneration, Tash, you were totally right on that. So we remunerate all activities appropriately. We know many students engage with us are super passionate and they would probably do it whether they were paid or not. But regardless, remuneration is really key to acknowledging that lived experience is expertise and they need to be paid for it. Lastly, flexibility. So meeting people where they're at, ensuring that we remain accessible, approachable, and continue to provide opportunities or change based on what the feedback is. So that's really, really important to us. We do meet people where they are, wherever possible. Our goal is to ensure that a variety of people and experiences are involved in our program. The purpose is always very clear about why and how they're going to engage. It's mutually beneficial and there's a clear feedback loop.